Hello there. Please take a seat and make yourself comfortable. I'm Dr. Sarah. Pleased to meet you. Could you just confirm your name for me, please? Okay. And date of birth? That's perfect, thank you. So let me just have a little look at the notes here. Okay. So you're considering having some cosmetic surgery to pin your ears back, am I right? Okay. So let's have a little chat about that then. Alright. So you've had no prior surgery on your ears for this? No, okay. Alright. And how much does it affect you in everyday life, being uncomfortable about your ears? Okay. Okay. Well, I'll take a little look at your ears shortly, okay, and we'll discuss what can be done, okay. Have you had any discussions before with any other doctor? Just once, and what did they say? Okay, okay. But you chose not to go ahead with it at the time. All right, okay. Incisionless otoplasty could be an option for you. I will have to inspect your ears and examine closely to determine whether it would be, but it's much less invasive with a faster recovery time. It just basically means that the ear is injected with local anaesthesia, okay, to numb up the cartilage area, okay, and then sutures are put through the ear and to anchor the ear back in place. It's not suitable in every case, so we will have to look into that for you. Okay. But of course, if another doctor has said it is suitable, then hopefully that's the case today when I have a look at you. All right. Okay, just bear with me a second. Okay. Are you allergic to latex at all? No. Okay. I'm just going to pop some gloves on. Yes, it's warm out today, isn't it? For sure. Okay. These can be quite tricky to get on when your hands are already warm, because I wear them pretty much all day. Okay. So, firstly, let me just take a little look at you, okay? Okay, I'm just going to come and take a look behind your left ear, alright. Okay. Just going to pull your ear back ever so slightly. Okay, pull that forward. Okay, let me just take a look at this side for comparison. Move that around, forward a little, and back. Okay. Can't see anything unusual there. Alright. Do you have any problems with your ears internally? Earache, itching, discharge, excessive wax? Okay. Alright, well, I'll give the ears a little wipe round and then I'll have a little look inside them. Okay, first. Get that little wipe. Gentle cooling wipe there. There we go. Feels nice, doesn't it? And on this side. There we go. Okay. I'm going to insert this otoscope into the ear canal very gently. Just have a little look down to make sure everything's fine and there's no deformities inside there. Alright, okay, we'll start with your left ear. I'll just pull up and back very gently, my lovely. There we go. And just gently insert the otoscope. Okay, is that okay for you? Good, good, good. Okay, everything looks pretty normal in there, which is good. Normal amount of earwax, nothing to worry about. No deformities, infection, anything unusual. That's perfect. Okay, just withdraw that now. Okay, you feeling alright? Good. And again, just going to pull up and back a little bit there. Okay. And insert the otoscope. Okay. Everything looking normal in there. Eardrums normal, ear canal normal. No excessive earwax, no irritation there, I can see. Perfect. Okay, just withdraw that now. Okay, so on initial inspection I can't see anything unusual there, which is good. I just want to have a further palpate around each ear, if I may, just to have a little feel around and see how the cartilage feels, you know, the angle of things that would need to be changed. Okay, I can see your ears do have a little asymmetry, that one is actually sticking out slightly more than the other. Okay, but that's not uncommon. No one is symmetrical. Alright, so it would mean that one ear needs a little bit of a different suture to the other. Might need extra sutures just to make everything balance up if we go with that particular technique. Okay, alright, just keep nice and still for me. I'm just going to have a little press around. Just going to touch around the ears there. Okay. Down to the lobe. Okay, it's going all the way around there, all around the pinna. Fabulous. Okay. Does that feel alright? Okay, I'll just have a look at this side. Okay, just have a little press around. All around the pinna again. Okay. Couldn't feel anything untoward there. Okay. So now I'm going to have a look around this part just behind your ear. Okay, I need to have a really good inspection around that area. Alright, I will be doing a little bit of pressing and poking and just running my finger around the area. Alright, but it shouldn't be painful. If anything is uncomfortable, please let me know. Okay? Here we go. I'm going to move your ear forward ever so slightly just so I can just look around the back there. Right, that seems fine. I can't see anything unusual. Okay. Around here. Okay, again, things look and feel good behind here. Okay. Perfect. Now, have you ever had any reactions to any medications before? Okay, any local anaesthesias? Okay, I will use lidocaine with epinephrine if I go ahead and do the incisionless otoplasty. Okay, I can use it without the epinephrine if that's a problem, but if you've got no previous history of problems, you know you've had that before, okay, that's fine. Okay, let's make a few notes. Okay, have you ever had any serious skin reactions before? No? Any known allergies? Foods or otherwise? No. Okay, so no meds and no food allergies, okay, that you know of. Alright. Any previous operations? Okay, tonsillectomy. Okay. Do you know when that was? Do you remember? Oh, okay, you're a small child, yeah. Okay. It used to be a very, very common operation. That's perfect. Okay. And what has really prompted you to want to have this kind of surgery done? Okay, to make you feel better about yourself. Oh, I'm sorry. And people do make fun of you. Okay. Well, you kind of think that when people are adults they wouldn't do that kind of thing. But I'm very sorry. And it's got you quite depressed. I understand. Okay. Right. Well, from what I've seen so far, I think you are a perfect candidate for incisionless otoplasty. Okay. Good, I'm glad that makes you happy. I'll run through a little bit of the procedure with you, okay? Yeah, nothing to be nervous about. I'll be back in a second and I'll go through it with you. Alright. Alright then. So, what I've got here is a very large, kind of crude representation of an ear. Okay? So this is the ear as you would see it from looking at the side there. Okay. The procedure would involve injecting the local anaesthesia into several areas. Now sometimes we may need to add extra little bits as we go along. Okay, it's not easy to say exactly where until the procedure is started. Okay, but we can see this. There'd be some just injections around. Okay, and then at the back of the ear, and this is very hollow, but at the back of the ear there would be some more points of anaesthesia. As I said, it's a very, very hard thing to determine where it would all go until we actually start the procedure. Okay, so because there are no incisions in this, what would happen, we start to use sutures and go through specific points in the ear, okay, with a suture, okay, like so, and we will keep going until we reach the desired effect when we pull on the sutures, okay. So if I was to say that the ear was sticking out, which yours aren't, sticking out like that, we would be able to pull it and it would pull back, okay. So that was a very exaggerated example, but your ear would pull back, okay, and would look in a more flat position, okay, and we would only ever do something that suited your face profile. All right, so there would be several sutures again. We wouldn't know exactly until we started the procedure, which would pull the ear back, okay. Then when we were happy with it, we would clean all the ear up and you wouldn't be feeling a thing, okay, and then we will put a dressing over the top of the ear, okay, and the process would be repeated for both sides, of course, but as I said, each ear would be slightly different in the way that we put the sutures, because we have to balance it all up, okay. Yeah. Perfect. Okay, I just want to take a couple of little measurements. All right, I'll just use this tape measure here, so just keep nice and still for me, and you'll just feel me just moving around your ear, just taking a couple of little measurements here and there. All right, okay. Perfect. Right, I'll just pop over here. Okay. Okay. Just want to measure just across your face a little bit there. Okay, one more. just going to have one last check down your ears with the otoscope, okay? Just a double check down there. So just let me pull up and back and I'll just pop this in there just quickly. Okay, yeah, that's all fine. Just double checking something there. Okay. Wonderful, just withdraw that there. And one last little look on this side. Perfect indeed. Just take that out of there. Right then. So, do you have any questions about the procedure? Okay. Yeah, we should be able to get that both ears done within an hour or so. Okay, depending on how it all goes, whether we need to do a little bit extra work than we originally thought. Sometimes, like I say, it's very difficult until you actually start the procedure. Yeah, but I don't see any reason why the incisionless surgery would not be suitable for you. In fact, I much favour it than the more invasive stuff, yeah? Yeah, of course. And it's much better for you with recovery as well. And you don't have to go through all the general anaesthesia as well, which is obviously much better. It will be done in our theatre, yes. So you've got a small theatre team there. Nothing to worry about. Okay, and we can talk to you about the aftercare when you go ahead with the procedure if you choose to do so. Okay. Are you a private paying patient? Yeah? Okay. Well, we should be able to schedule that for you in about 10 days' time. How about that? Yeah? Okay. Right, well, I'll get our receptionist to sort that out with you. Okay, I'm just dropping her a little note now with what's to be done. She'll give you an information leaflet on everything you need to know before you come in on the day. Okay. And, you know, this time in about maybe a month or so, you'll be feeling so much better about your ears once they've all healed. Yeah. And it's not an uncommon thing. Not an uncommon thing at all. We do many of these procedures. So feel very confident that you're in safe hands. Yeah. Okay, well, I'll see you again hopefully in about 10 days' time. And we'll get this done for you. Okay, it's been lovely meeting you today. Take care then.